So the first story is how doctors are now using AI to record patient visits. And this particular story is in Philadelphia at Temple University. And they talk about this new generative AI tool that's increasingly present during doctors' visits in the Philadelphia region. Now, I found this interesting because I've dealt with this myself. And I now, having to visit doctors quite frequently, I'm noticing now they just recently said you have to sign a document that says, is it okay that we use AI to record the conversation? And I've actually had doctors where they've come into the office and had somebody assist them taking notes. I'm not sure if it was AI or not, but they had somebody assisting them so the doctor could really pay attention to the patient. But it listens, it takes notes, it summarizes key points after each visit. And the idea is to let the doctors focus more on talking to the patient, which makes sense, and saves them from spending time after a visit to organize and type up their notes. Now, I've always seen in the beginning, I've had a family member who would do transcribing, medical transcribing. So they would take doctor's notes and audio notes and then type them out. And it kind of makes sense now that AI is sort of going to take that job over. Now, there's a doctor out there called Laura Igarabuza. Gotta love these names. A family medical doctor at Temple Health. And she's been using it for almost a year and said it's been a huge time saver. She said, before I started using this technology, I don't think that I realized how much mental energy I was exerting to interpret what the patient was telling me and type it into the chart at the same time, she said. This ambient listening tool uses artificial intelligence to create clinical notes from doctor-patient conversations in the exam room. It was an awkward setup with the keyboard in front of her and the patient next to her. I'm kind of like trying to turn my neck to look at the patient and really make eye contact, engage with them while I'm typing. Because this is the old way that she was taking notes. She said using the AI tool lets her spend more time with the patients, which brings back the joy to medicine. And so the ambient listening clinical documentation tools evaluate and sort the information in the conversation between the doctor and patient, creating concise notes and discarding irrelevant information. Now, I have a device that's similar to this that you actually can take and put on the back of your phone, and you can record conversations and things like that. And all of this stuff, by the way, is all based on ChatGPT or Claude or any sort of AI system that is similar to those. So whatever this system is using one of those systems in the back end to figure all this stuff out. Is very similar to this device that I was using. And so what it does is you can have and some of you may use this too in meetings that you have with maybe Microsoft Teams or something like that, where the AI essentially sort of transcribes the conversation that you have and puts it all together in notes for you to go over. And to me, I think it's a huge help. And what it does is it can kind of summarize the conversation without you having to do it yourself. So you can concentrate on the meeting. You can concentrate on the conversation. More than 80% of family medical doctors at Temple Health and more than 70% of doctors at Penn Medicine use these generative AI tools according to the health systems. Jefferson Health estimates this technology saves each doctor an hour of their time each day, which is also good considering how much time we all wait in the waiting room. WellSpan Health in South Central Pennsylvania said that since adopting this technology a few years ago, doctors have saved enough time so they can see an extra 2 to 5 extra patients each day. So I don't know if that's good or bad, because then, of course, they start kind of cramming patients in. But To me, hopefully what it does is it allows that doctor to, move on from one patient to the next. After the University of California, San Francisco's health system rolled out similar technology for their doctors, the response has been ecstatic, said Dr. Robert Wachter, chair of the Department of Medicine and author of the upcoming book, A Giant Leap, How AI is Transforming Healthcare and What That Means for Our Future. He said the comments are unlike anything I've seen in technology and healthcare. While people usually complain about the technology, he said the comments are, I was thinking about retiring until this came out. Now, that's a pretty strong statement that doctors were thinking about retiring until this came out. That's interesting to me. I think that it's a great technology. I don't know if it's quite there to keep somebody from retiring from medicine, but I don't know. The health systems say the technology will become a normal part of doctors' offices in the future. Well, I think it's going to become way more than that. Not only is it going to be something that dictates notes and things like that, but it's also going to be doing diagnoses, and it's also going to be doing a lot of the surgeries itself. So this is very much the tip of the iceberg of what AI is going to be involved in medicine. I can assure you of that. Researchers at Penn Medicine recently published a journal article describing how 46 doctors across 17 specialties felt about the AI tool after using it for a few weeks late last year. When the researchers asked the doctors whether they would recommend it to their colleagues, this is interesting. Half of the group said yes, whereas the other half said no. Now, this is kind of interesting from the beginning of the article, because it seemed like to me, when you're reading the beginning of the article, that everybody was into it. But now it's saying 50-50. Some said the automated note-taking makes them more efficient, whereas others said they have to spend time editing the AI-generated notes to make them fit their usual style. I'm going to get into this in a second because this is very important. Dr. Corinne Rhodes, a general medicine practitioner with the Hospital of the University of Pennsylvania, uses an ambient listening tool on her phone to take notes during patient visits. That is the case with Dr. Corinne Rhodes, a primary care physician at Penn Medicine. She used the AI listening program in a recent patient visit. She explained that she's developed a system of writing concise notes after years of experience, and now needs to heavily edit parts of what the AI generates for her. However, she expects the program to get better in the future, to the point where it consistently saves her hours, so she wants to start learning it now. Okay, so getting into AI, and you can, by the way, while I'm doing this, in the description, we have some AI prompts that you can download. And we're going to have a lot more as time goes on that you can use. And the AI prompts that we have currently are for helping you write, whether it be a transcript, whether it be a paper, whether it be an article, that makes it humanizes the AI. It helps you take your own ideas, put it on paper, and then make it sound as if it was something that was written by a human, as opposed to just simply putting a bunch of stuff into AI and letting it come back and write it for you. This is the problem here in this particular situation, where you have a doctor that's using AI. However, they're just putting their notes in without any sort of prompts or instruction. And if you're not training the AI and telling it what to do, or in this particular, she says she's developed a system of writing concise notes after years of experience. Well, what she needs to do is take her system on how she's created those concise notes and create prompts to the AI in order for it to create precisely what she has done in the past. So there is a way of training the AI in order to do that. But these certain people in this particular case, and it's not surprising, and it's not a slam on anybody who doesn't know this, these are things that you have to learn over time, that the AI has to be trained. You can't just simply put it in the AI in hopes that it's going to come out exactly the way that you want it. It's not going to happen that way, at least for now. So she's a general medicine practitioner at the Hospital of the University of Pennsylvania. She consults Open Evidence, a medical information platform that uses artificial intelligence to aggregate and synthesize medical research. Once again, just like any of these things, they're based on a ChatGPT or a Claude or a DeepSeek or any of these on the back end. There's really just nothing that does. There's no separate AI system on its own that does like medical transcribing or certain things. It's all based on this stuff. So these are things that you could take your notes, put it into ChatGPT with prompts and instructions, and have it do it the way and transcribe it the way that you're comfortable with in your style and your formulation or whatever you want to call it. We're already finding that there are healthcare providers who are asking for it as a condition of employment. They're saying, if I come, I really want to have access to ambient scribing, because they've already seen what the detriment of not having it looks like. Imagine this now. You're actually requiring that you have this technology before you come to work there. I remember the old days of tapes and writing things down in notes and tape recorders and things like that. And look how far we've come. So Kevin Johnson, a professor of biomedical informatics at the University of Pennsylvania, said some doctors already expect these tools to be available. He was part of a research team that found doctors had mixed reactions to using the AI note-taking program, and pointed out that since the time of the surveys, program developers have released several updates to improve the software. And again, this is more prompting and things like that. The technology could go beyond just physicians. Penn, Jefferson, and Temple are planning to test these AI listening programs for nurses as well. Makes sense. But this could mean that nurses have to change the way they practice, said Colleen Malazzi, Senior Vice President and Chief Nursing Informatics Officer at Jefferson Health. For example, she explained that while doctors may be used to saying out loud what they are writing down in their clinical notes, nurses are used to assessing patients by silently noting down details like whether a patient is out of breath or not in a flowchart. Using the AI note-taking technology means a nurse would have to dictate all of their assessments. Well, you can also write these things down, and you can actually take photographs of your notes and have those notes actually go into the AI system to finish whatever it is that you're doing. So there are ways of integrating that. It doesn't necessarily have to be all dictation and conversations with the patient. We have to get them outside of this innate discomfort of saying it all out loud. You don't have to, though. You can write it down. Because it would be weird for any of us to have to say everything we do out loud, she said. And there's going to be different interactions that occur with patients. There's going to be a lot more questions. This is good because then patients are engaged in their care, but it's different. But anyway, yeah, back to, this technology is advancing to the point where a lot of this stuff you can take photographs, screenshots, things like that, input it in the AI. However, you have to have the correct prompts. So like I said, we are developing, and you'll see them in our description. Just download that first. We have a free prompt that you can download. You'll be put on the email list. And when we start coming out with these new prompts for these different technologies, you'll be able to have them. This is a super interesting story, and how AI is changing medicine. But this, like I said before, is absolutely just the beginning of it. And it's going to transform a lot more of medicine, even more physically than just note taking. But let me know in the comment section if you've experienced this. Have you had a doctor tell you that they want to use AI to dictate notes and things like that because they're making you sign the consent form before you do it, which is good. But I'm curious to see if you've experienced that. I certainly have, and I like it. Again, because I use it. I'm involved in AI, and I think it's a great tool. And I would rather have the doctor pay attention to me more closely than busy taking notes and typing things into a computer. But let me know what you think.